Okay, so we've now decided that we are going to give TPA to our patient that is suffering from a stroke. I run to the Pyxis, I grab my Altaplace. If you just type in Altaplace on override for this patient. If you need to, if this is a rapid response patient, then they will come down and they won't be in our Pyxis. You'll be able to global search them in the Pyxis to find them. So just bring a sticker or something with you. Once you pull it out, you're gonna see these two bottles inside with a transfer device. What we're gonna do from there is we're gonna take our transfer device and we're gonna put that with the TPA on the bottom. We want the powder on the bottom. We're then gonna take our sterile water and we're going to set it on top with both of them. Let it completely empty into our TPA. Once it's done, you're gonna gently swirl. You don't wanna shake because then we're gonna create bubbles. From there, we're gonna come over and we're gonna hang our entire dose on here. This is 100 milligrams and 100 mLs. We will never give this entire dose. So now we've primed our entire tubing with our 100 mLs and 100 milligrams of TPA. You can put it on the pump if you'd like to at this point, and we'll program it in a few minutes once we figure out our dosing. So we'll still keep this 100 mLs here. From there, we're gonna look at our patient's weight. So we know that the total dose that needs to be given is 0.9 milligrams per kilogram per hour, over 1 hour, I'm sorry. Our patient is 70 kilograms. So we're gonna take 70 kilograms times 0.9 equals 63 milligrams. This is going to be our total dose. At the same time, we have these cards in our resource folder and in room 14, which would be our stroke alert room. You can use this to look up, there's a total dose column, a discard quantity, a bolus dose, and an infusion dose. This will tell you everything that you need to know when the patient weight is exact, as far as what's on this card. Otherwise, you're gonna need to know this equation. So we have a total dose of 63 milligrams. Our waste is 100 mLs, the entire contents of the bottle, minus 63 mLs, which is what our total dose will be given, which leaves us with 37 mLs. From there, I have a 50 cc syringe, depending on what your bolus is. From there, I'm going to withdraw. Make sure your port is open. I will draw 37 mLs and discard. This is not going in the garbage. So that's my waste. Now I need to look at my bolus. My bolus is 0.1 milligram per kilogram, which equals 6.3 mLs. I take my 10 ml syringe. I withdraw 6.3, which will be hard on these syringes, but they're still getting their entire dose. We just want to bolus them with that. From there, you can connect your patient to your tubing and give it through the Y site here. Okay, once you give your bolus, then we can look at our remaining fluid, which is our remaining dose. From there, I'm gonna go to my guardrail drugs. And you'll see that we're in the A section, so we're just going to keep scrolling down until we see Altaplace. There are 6 different versions of Altaplace. We have stroke, ecos, lysis, pulmonary embolism, submass PE, and Altaplace MI. Obviously, we're treating a stroke, so we wanna go with our stroke. From there, we have 2 options, less than 100 and greater than 100. For this, we're gonna use our less than because there's a little bit more configuration needed. So we know our drug amount is going to be our 56.7 mLs. And milligrams, it's a 1-to-1 concentration. So we're gonna program that in, which is then gonna bring us to a dose of 0.81 milligram per kilogram. But we just said our dose is 0.9 milligram per kilogram. We've now taken our 0.1 away for our bolus dose. So now that leaves us with 0.81 milligrams per kilogram. We're going to infuse, we'll start and let that run. Once we have completely emptied out that 56.7, we need to make sure that this bottle is completely empty when we're ready to then hang our flush bag. So we're going to, once this is done, we're gonna hang a 50 ml flush bag, and we're gonna infuse it at the same rate as the TPA, the entire 50 mLs. And what that's doing is ensuring that they have gotten the entire dose through the entire tubing. Once we're done with that, we're going to continue our Q 15-minute vitals for another hour, and then we're going to progress to our Q 30-minute vitals and neuroscience. You can throw away and discard this entire set once you've completed it.